Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. We are advising a 41st and 42nd death due to COVID-19. A female in her 80s and a male in his 70s from the Winnipeg Health Region. These cases were previously announced and connected to Heritage Lodge. We send our condolences to their family and loved ones. The current 5-day COVID-19 test positivity rate is 4.2%, with 80 new cases of virus being identified as of 9:30 a.m., bringing our total number of cases in Manitoba to 3,382. Today's cases, we have 4 cases in Interlake Eastern, 5 cases in Northern Health, 6 cases in Prairie Mountain Health, 14 cases in Southern Health, and 51 cases in Winnipeg Health Region. There's 1,743 active cases, 1,597 individuals listed as recovered. We have 28 people in hospital, 6 of which are in intensive care. The number of deaths due to COVID-19 is now at 42. The average HealthLinks wait time is 76 minutes. The average total test turnaround time is 60 hours. Lab testing yesterday, 1,677 tests completed, taking our total to 226,594. Possible exposures are posted on the Pandemic Response System website. We have partnered with Doctors Manitoba to enable COVID-19 testing at community medical clinics by physicians. Dakota Medical Center at 845 Dakota Street in Winnipeg will be the first to introduce dedicated COVID-19 testing. Testing at Dakota will become available in the coming days. Information about how to access the testing at Dakota will be available soon. And please note that they are not taking patients for COVID testing at this point. Further information will follow. Clinics that do offer testing will ensure protocols in place to separate COVID testing from regular medical appointments, including regular disinfection, physical separating the testing from regular appointments. Effective today, we have implemented additional restrictions for the Winnipeg metropolitan region under the restricted or orange level of the pandemic response system. So we continue to encourage everyone to reduce the amount of contacts they have outside of their household. Do avoid closed-in, crowded places. Wearing a mask in indoor public places. If you're out someplace and it's becoming crowded, do consider leaving. So again, we've heard lots of the fundamentals, and we do need to get back on track with those fundamentals. We need to focus on those fundamentals for the near future. Very important in that is staying home when you're ill, even mild symptoms. We've seen many instances of multiple contacts to cases because people were not staying home when they're symptomatic. So we do need the people to adhere to that. We've had individuals who were symptomatic and even went for testing and yet still went out and had many contacts while the results were pending. So if you're symptomatic, do get tested, but self-isolate pending results. Stay home when you're sick. We always recommend washing your hands frequently or using an alcohol-based hand sanitizer, practice physical distancing, and wear a mask in indoor public places. And we need to adhere to all of these. It's our layered approach which can protect us. It's protected us before and will do so at this time again. What is another fundamental this time of year is to get the flu shot. We know that the flu virus is on its way to Manitoba. Just like every year, we'll have a flu season which includes a number of other respiratory illnesses. Those fundamentals that we use for COVID will help protect us against those viruses as well. But for influenza, we have another advantage, and that's the flu shot. It's safe and it's effective. It's the best way to protect you and people you love from influenza. So I encourage all eligible Manitobans, those 6 months and older, to get the flu shot this year, to get it early. Do get it as soon as it's available to you. We want to protect ourselves, protect the rest of those loved ones around us, because we do know we're likely to see both COVID and influenza circulating at the same time in Manitoba. So we have to do what we can to protect ourselves against the flu. We have our additional restrictions coming into place in the Winnipeg metropolitan region. And we remind everyone that we do have travel restrictions to northern Manitoba. So non-essential travel is prohibited at this point. Again, we see this issue with increased circulation of the virus in the Winnipeg metropolitan region. We have to do what we can to protect the introduction of that virus into our remote isolated communities. So please adhere to those travel restrictions. And so for more information, visit our website, manitoba.ca/COVID-19, and I can open up for some questions.
Thank you, Doctor. A reminder to our reporters on the phone. All the reporters are on the phone today. You will have one preliminary question and two follow-up questions today. Up first, from the Winnipeg Sun, Scott.
Good afternoon, Dr. Roussin. Scott Billick, Winnipeg Sun. Hearing reports over the weekend that positive cases are still taking a long time to get out to people. One person we spoke with waited 7 days for a positive result, and a family member who ended up being negative only waited 3 days. Is there still a lag on people actually getting those results, and why is it taking up to a week for positive results to get out to people?
So the median total test turnaround is around 60 hours right now. So the vast majority of people are not waiting that long. There are always outliers, so I can't speak to specific cases, but the majority of cases are being identified and addressed much earlier than those cases that you're reporting.
Okay, thanks. And my first follow-up then is, the Restaurant Association is saying that they haven't had an active contact exposure in a restaurant since September 26th. And they're also claiming today that they weren't consulted on the new orders. Why weren't they consulted, regarding restaurants, bars, or bars at least being shut down and further restrictions on restaurants?
So I know that there was a consultation that took place in the first round of the going to orange. As we started seeing those numbers climb, we had something like 3 days in a row of record high numbers. So we had to act relatively quick. We did reach out to those sectors, but probably just the nature of how quickly we had to move didn't really allow for a deep consultation on there. As far as exposures go, remember that there can be some skewing in the reporting, right? So we will announce exposures in public when we can't track down all the contacts, and so with the exception of schools. And so for schools, we've committed to Manitobans that we would provide information on every single case in schools, even when there was low risk or even when we didn't think there was any significant contacts. And so just following those type of reports isn't sufficient to know what's going on out there.
Okay, thanks. And just my third question. Can you give us an update on some of the outbreaks at PCHs in the city?
Yeah, I do have some updated information on there. I don't know if there was a specifics that you wanted to know of. There was 84 currently at Parkview Place, 73 of which are residents. Heritage Lodge is 15 total, with 14 in residence.
From CBC Radio Canada, Chloe.
Good afternoon, Dr. Roussin. Chloe from CBC French Radio Canada. Can you give me an update about the outbreak that was announced this weekend in St. Boniface Hospital after 2 people got infected? More people were on the way to be tested. Did you get any more people that received a positive test after that?
I'm not aware of any further cases there. We'll get updates on that regularly, but as soon as those cases were identified, then the infection prevention and control measures are added, measures are put into place, and to try to limit further spread.
Thank you. And as a follow-up question, these new measures that were in effect from today are planning to be established for 2 weeks minimum, that some bar and restaurant owners are concerned that they will stay longer because we know that the pandemic won't stop in 2 weeks. Do you already think of postponing these measures?
Well, certainly we wanted to, these are important measures that we're taking, and so we want to make it clear that we are paying attention to the timeline, so we're going to leave these on for the shortest duration that's required. And so that would usually be 2 weeks, and so we'll always review it. But we want to make it clear that on these orders, we have these set to that they must be reviewed again within 2 weeks. So we're paying very close attention to that. It's of course going to entirely depend on the numbers we see, and so if we see improvement, if we see the transmission of the virus decreasing, if we don't see strains on our healthcare system, then it's quite possible we can roll back some of these restrictions. Anyone who's saying that this virus is going to be with us for quite some time and we're likely going to see some sort of restrictions in place is correct. This virus isn't going away anytime soon, so we have to find ways to deal with it in the least restrictive means possible.
Okay, and last questions. So these restaurants and bars are directly impacted by the new restrictions, and they're asking for more specific help for the sector than the way they got to hire back some employees. Is there something that is on the table?
Well, I think that's an important issue. It's not something that I can speak to, though. Public health isn't able to speak to the details of that.
Thank you, Doctor. From CBC Manitoba, Bart.
Dr. Roussin, this year, we have spoken to a COVID-19 patient who tested positive and then wasn't called for contact tracing until 1 week after the positive test notification. We know that there is a backlog in contact tracing. How is this being rectified? When will it be rectified? And what is the average backlog to actually getting people contacts notified and traced?
Yeah, and so with the escalating case numbers in the Winnipeg region, that did put a lot of added strain onto contact tracing. The total turnaround time is still at around that 60 hours. That's a median. And again, there are always those outliers, so that's certainly not the norm to be waiting 7 days to be contacted. So I don't know about that specific case, so I can't speak to it. Definitely, that's not our goal. We need to be contacting people, having them advise us of their contacts, getting contact notification much quicker than that. And so for the most part, it is happening quicker than that, but there are some outliers. So we've, took a number of measures. So just in the immediate term, just increased staffing directing at contact tracing. You've heard of the agreement with Canadian Red Cross to assist with contact tracing. We've also been working with Statistics Canada, and so these are pending, but will be in place in the very near future. So we've taken a lot of steps to try to build up that contact tracing capacity.
What can you tell tell us about the new system that you've just put in place for contact tracing?
Yeah, there isn't a new system. There isn't a new system that's just been put in place. It's, our public health information management system. It's been in place for quite some time. So we don't have a new system.
All right. And what more can you tell us about the two deaths yesterday? Were they in personal care homes? And is that connected? Why are we not seeing the First Nations death that was announced Friday by the First Nations medical authorities in the numbers yet?
So these two deaths were connected to Heritage Lodge that we reported today, and the other death I don't know why that hasn't yet made it into the reporting structure. There can sometimes be that lag to get it into our the provincial set.
From the Canadian Press, Steve.
Yesterday, Doc.
I'll ask Bart's question. He was asking about the two deaths announced yesterday. Is there any more detail as to whether they're connected to a long-term care home?
Let me see here. So we had on October 18th a male in his 70s, and that was from Winnipeg. There's a female in her 70s from Winnipeg, and that was connected to Parkview.
Okay, thank you. The daily count of new cases is still very high, but it's dropped somewhat dramatically from that surge that we saw last week. It coincides with about a 9 or 10 day period following the early last call and early closure of licensed premises. Correlation doesn't always mean causation, but do you think that the drop that we have seen to date is due to the restrictions on licensed premises that you imposed a couple of weeks ago?
So you're right. It's hard to suggest exactly what had caused it. It's still early on. We've seen some drop in the numbers, and certainly that's welcomed. Certainly that's the intent of putting those restrictions in place, was to have an effect on these numbers. So the intent was certainly that, we'll continue to follow these numbers. We hope that that's our downward trend now.
And Scott asked you earlier a question about restaurants and bars, and there might be some misconception in the public there about exposures versus where transmissions are occurring. The most recent data you have, and I know some of it is online up to October 10th, it's still a lot of that close contact transmission. Is that happening in restaurants and bars still? Is that still what the data is showing you up until what's the most recent collection?
So there is certainly some of that. And again, when we talk about, there's transmission events and then there's acquisition events. And so the acquisition events are usually not quite as clear. We look at cases that we can't link conclusively to specific transmission, and then we look at their activities. And so a lot of those activities were at these type of centers. Doesn't mean that that's necessarily where it was acquired, but it certainly shows that there was a lot of movement in those. And we just know with this virus is it's prolonged indoor contact. And so, so businesses that have that as a major part of their business operation are unfortunately, quite affected by this pandemic. And so when we see the cases going up, we have to, do whatever we can to try to keep the numbers manageable. We obviously want to do it in the least restrictive means possible. But, these steps is where our epidemiology was directing us.
From CTV Winnipeg to Ria.
Hi, Dr. Roussin. We just received an email that St. Mary's Academy is moving its grade 9 to grade 12 students to remote learning. I just wonder if you have any information as to why that decision was taken and just how the province is, dealing with school divisions or private schools when it comes to remote learning, whether that's going to be an option that's made more available.
Yeah, I don't have any information on that decision, on the specifics of that. And I know that public health, education, they've been working quite closely with all of our stakeholders in education about things like this. So I'm sure education will have more to say on remote learning when that's, if that becomes relevant.
What does the test positivity rate have to be for these restrictions to be lifted in 2 weeks? What do you need to see happen for things to go back to the way they were?
Well, we definitely expect a trend downwards, so a clear trend downwards. We've often used that 3% test positivity rate, especially if we're seeing community transmission. And so we would expect that number would be under 3. But again, we don't look at only one indicator, so we wouldn't rely only on that. But as far as test positivity goes, that's what we'd like to see, a trend, and most times we would expect that to be under 3%.
And then just to clarify, both deaths on October 18th were linked to Parkview?
Just the one.
Just the one, okay. All right, thank you.
From City News, Jonas.
Good afternoon, Dr. Roussin. Today we are seeing some restrictions on the Winnipeg metro area that's going to impact, pretty much every aspect of our way of life. It seems we are taking a pretty significant step back. Just your message today to the community at large, if you don't mind, sir.
Yeah, I mean, I think that we've seen these increasing numbers. We know that when we see large numbers like we did late last week, that gives a lot of people moments of pause. We've continued to see our healthcare system functioning, but we have seen added strain on things like our testing and public health capacity. And so I think we do need to take these steps. We've been talking about fundamentals for quite some time. And it's everyone realizes it's very challenging to consistently adhere to these, and so that's why sometimes we're going to be required to act, to put some restrictions in place to try to get us back on track. But hopefully in relatively short order, we can see the trends we want to see and lift some of these restrictions. But again, it's not going to be a return to normal. We're going to be dealing with this virus for this foreseeable future. And so we're going to need to adhere to these fundamentals with or without restrictions. But I really feel that these restrictions are put in place for a finite amount of time before they're required to be reviewed. And we're expecting to see those numbers trend down so that we can change our approach, hopefully loosen some of those restrictions.
And as a follow-up to that, sir, just the messaging to the community about the seriousness of the situation in Winnipeg. Can you just kind of maybe elaborate a little bit on this? Where are we right now as you look at this?
So, certainly the trend we were seeing late last week was quite concerning. We haven't seen that yet continue in that upward trend, the trajectory that we saw late last week, which guided us to implement these measures. But so it's important to know that our goal isn't to eradicate the virus. Our goal isn't to not see cases. We're going to see cases, and so we can't rely simply on the total case counts to guide us. But we do know when cases go up, that puts a strain on testing because our test positivity rate puts strain on our lab capacity. We know it puts strain on public health. And typically, as the case numbers go up, we will see that lag, and then that will translate into increasing hospital admissions down the road. So it's best to act and try to get out ahead of things before we see that significant strain on the acute care system. And so now is our decision point to make those changes, to get back on track, and try to again decrease the transmission of this virus.
And for my final follow-up, on just a separate note, we are receiving some questions from families regarding Halloween this year, stuff like that. We are going to see these measures extend into then. Any decisions yet on what Winnipeg can see?
Well, we have guidance online for gatherings as well as Halloween, and so the group sizes are going to have to be adhered to, and Halloween's going to be different this year no matter what, and so we have to try to avoid large gatherings, try to keep our contacts low. And I really encourage people to start thinking about, what their Halloween's going to look like, how they can do that with reducing their contacts outside of their household, and to really make this, a safe Halloween in all ways, including practicing the fundamentals.
From the Winnipeg Free Press, Danielle.
Hi, Dr. Roussin. Danielle from the Free Press. Can you tell us regarding the cluster at St. Boniface Hospital, how many people, either patients and staff, are in isolation because of coming into contact potentially, and do we know how the cluster began?
I think it was began with patients testing positive, 2 patients that tested positive. I don't have a number on the total amount of people that are self-isolating at this point.
Mm-hmm. Okay, and I'm wondering, with the change coming to testing, with it being available in clinics, has anything changed in regards to our lab capacity to, accommodate that extra testing?
Well, nothing specific has changed. We're still looking at a number of ways to improve that capacity, but there hasn't been any specific changes.
And and with on the other end of the testing spectrum, when people are presenting for swabs at our testing sites, we saw a really high demand in mid-September. Has that demand remained consistent, perhaps in the past week, or are we seeing demand for testing also fall off?
It varies, so we usually see a high demand for the tests in the early parts of the week. We see that diminish as the week goes on to usually the lowest testing day is Sunday or on long weekends. And so it varies over time.
From Global, Marnie.
Good afternoon, Dr. Roussin. Just speaking with some businesses and restaurants impacted by these new restrictions, there seems to be some confusion or frustration over how they're categorized due to their licensing. You're hearing from some that are licensed as beverage rooms, but say they're really more of a family-friendly venue. They've been following all the guidelines. What's your response to that? And could there have been a bit more leeway for businesses that kind of are in a little bit of a gray area when it comes to their categorization?
Yeah, and so this represents one of the challenges when you're writing orders like this, because there'll always be those gray areas, but you can't write legislation or orders or regulations really to account for that. So it is that challenge. So we're working like right now even to try to clarify that, to see if we can come to a way to have these orders that will be in place to reflect some of those concerns. But it is a challenge when you have certain areas that are more gray. Usually orders have to be written in a black and white manner.
Thank you for that. And you've also spoken in the past about obviously how this virus affects everybody. You've given examples of people in hospital and ICU, not always over the age of 65. What's the current age ranges that you're seeing for hospitalizations and individuals in ICU?
Yeah. So we do see, in the past we've seen a number of, a variety, a large range of those in there. I'll just see if I can find quickly our current. Yeah, and so they don't have sort of the current people in there. We do have that age range, from the 20s to the 80s in ICUs. but that might not be reflect the current numbers. That's a total range that we've had.
And in your opening remarks, you mentioned that reminder about northern travel restrictions. Why are you bringing that up again? Is that because you've been seeing issues with people not adhering to the restrictions to travel to northern Manitoba?
We have been hearing that. We've heard of people of non-essential travel to the north. We're also seeing, increasing cases in the northern health region that we're watching very carefully. So we want to ensure that we're protecting the north and the remote isolated communities.
From the Brandon Sun, Colin.
Hi, Dr. Roussin. Colin Clark from the Brandon Sun here. Here in Prairie Mountain Health, we've had pretty low daily case count since our code orange was lifted, but lately I've seen a couple of higher days. Like last week, we had 8 cases. A couple times in the last over the weekend, we've had 6 daily cases. Do you have any worry that Prairie Mountain Health might be going in the wrong direction at this point?
Well, coming into respiratory virus season, we have to all be very careful. And so when we talk about the pandemic response system and say lift Prairie Mountain Health, we didn't lift it to green. We're still in caution, right? We still need to be well aware of this virus that's circulating. And so we'll certainly see cases in all regions. What we want to make sure is that those cases don't have 50 contacts. So everyone has to be aware that, at all times we have to be adhering to the fundamentals. So we're watching all the regions closely. We don't know what necessarily things will look like once we see a significant respiratory virus season. And so, we all have to be aware that are restrictions in place everywhere in Manitoba right now. Just certain sectors are seeing more transmission at this point. But everyone's at risk.
My follow-up question is, we now have our second testing site at the Keystone Center here operational. Given that we had a second testing site at the Keystone Center that was taken away or closed down for a little while, how long can we expect Brandon to have 2 operational testing sites for?
I can't answer that specifically. I would say that we're really trying to do what we can to meet the demands, and so we'll continue to try to do just that.
And I don't have a third question.
From CJOB, Amber.
Hi, Dr. Brent Roussin. It's Amber from CJOB. We're hearing of people who are symptomatic, like you said earlier, and that they're waiting for tests, but still then going out and spreading the virus. We haven't been hearing a lot about enforcement and maybe raising the fines. What's the kind of message there when people are kind of going out, but then not really facing some serious fines?
Yeah, so that is something that we're looking at. We want to ensure that when we're imposing these restrictions on businesses, imposing restrictions on Manitobans, that they're backed with enforcement, because we really want these restrictions to be adhered to, so we can go back to lifting them. Certainly not back to normal, but with the less restrictions. And so for people who are symptomatic and not yet a case, that doesn't necessarily fall under our orders. But we really want people to be aware that if you are symptomatic and you did the right thing to go get testing, then you should be self-isolating pending results. And it's very very important for all of us. And the same thing for people attending physicians' offices. If people are having respiratory virus symptoms, we can't distinguish those from COVID, from other respiratory viruses without testing. So we want to be advising our patients to be self-isolating pending results, and not having our patients return to work or school if they have respiratory symptoms.
Just clarifying that then, so currently the only type of enforcement is for people who have already tested positive for COVID-19, not people who are awaiting results. And then are you looking at kind of expanding to include those people as well in enforcement?
We could, if you look at the self-isolation orders, they require first that the person be notified by public health that they are required to self-isolate, and so that would be a case or a contact. So, but we could look to expand that if necessary.
Are you guys going to be releasing any new criteria for symptoms to keep kids home from school daycare? I know we've been seeing more cases at schools and daycares.
Well, we're always updating our online screening tool. We want to make sure that it's, it's a balance between absenteeism and not missing cases. So we look at that regularly. We don't have anything immediately in the works for changing it.
From the Globe and Mail, Wency.
Hi there. This is Wency Liang with the Globe and Mail. Thanks for taking my question. I'm just wondering, you mentioned the median wait times for testing turnaround, but I wondered how long personal care homes are, especially those that are experiencing outbreaks, are having to wait for their COVID-19 test results.
Yeah, and so, typically the healthcare workers as well as institutional outbreaks are prioritized. So I don't have a number on that, but they're certainly at the shorter range of that total turnaround time. So we typically try to prioritize those groups.
Okay, and how are you actually prioritizing those groups?
So typically, for the most part, the labs, the tests are being run, as fast as possible. As fast as the tests come in and getting, put into the system. Sort of for the most part, we try to pool samples. And so what will happen there is if a test within the pool is positive, then now that pool has to be broken down and further testing done, so that adds a bit of a delay to it. So when we prioritize groups, we run them in a non-pooled fashion to try to get those tests back quicker.
And last we checked, under 20% of the tests in the Winnipeg area were turned around within 48 hours. Can you tell me what's being done to kind of speed up those turnaround times?
Well, the turnaround times have, the total turnaround time has a lot of variables in it, right? So it's the time to get the swab to the lab, to be processed at the lab, results submitted, and then results disseminated. So we're looking at each of those steps. We had a review to look at our entire time, so we'll be putting in measures to try to reduce that total turnaround time, but it's many variables that we need to look at.
From CHVN, Taylor.
Hi, good afternoon, Dr. Roussin. This is Taylor Brock from CHVN. My first question is, now that Thanksgiving is it's been about a week, have you seen any cases come from those gatherings yet?
We don't have any that we can specifically link to that, and so we're about that week and a little bit more. So if we're going to see a spike from that, it's going to be in this during this week. We'd likely see. So, but I don't have any specifics that are related to a Thanksgiving gathering.
And next month, those personal care home visitor pods were set to open. Is this still going to happen in Winnipeg?
I don't have a lot of details on update to that. I think that the plan was to be able to have those up and running. So, we know the importance of protecting those facilities, but we also know the importance of being able to connect with family and loved ones. So the plan was to be able to have access to those.
Now, every press conference, often you're reminding people about sticking to the fundamentals, but you are still seeing the number of cases increase and the number of deaths increase. How are you feeling about all of this right now?
Yeah, I think that we just have to continue to understand that we're going to continue to see this virus. that we can't focus necessarily just on the total cases that we see. We have to focus on, on the strains on the healthcare system and what this virus is doing in that manner. But we just have to realize that we're not done with this virus, that we had a bit of a reprieve this summer. And since then, we've probably, lost track of the fundamentals. And so it'll take this climb here now to get us back on track. And hopefully we can continue to be on track with that. But it's very likely as we move forward we're going to see peaks and valleys. We're going to see peaks and valleys in our jurisdiction and within our jurisdiction, and it might occur at the same time or different times with other jurisdictions. And so this is that new normal right now where we're going to continue to see fluctuations of case counts.
From the Thompson Citizen, Ian.
Hi, Dr. Roussin. It's Ian Graham from the Thompson Citizen. First question, have there been any more positive tests among people connected to the YWCA in Thompson?
I don't think there has been any more that occurred. We can get an update on that. We do know that we're seeing more cases in Thompson. We've seen now, non-epi-linked cases in the Thompson area. So we're watching that situation very closely.
Do you know how many of the Thompson cases? I think it's 7 active cases right now, but do you know how many have been epi-linked or how many that the source is not known?
No, I don't have that detail in front of me.
Okay, and I guess, just what should people take from the fact that, the number of cases in northern Manitoba in general is more than doubled over the past 2 weeks from about 18 now to there's 45, recovered and active. But what should people take away from that? What conclusions should they draw, if any?
Yeah, I think that what we need to continue to conclude is that we're not helpless against this virus. That we'll see those numbers double, but it's not out of our hands. We can all take steps right now to reduce the impact of that transmission, and that's those fundamentals. So we'll continue to adhere to the northern travel restrictions. All those fundamentals: hand washing, staying home when you're ill, physical distancing, wearing a mask in indoor public places. So we all know what we can do, and we know that that's challenging to adhere to it all the time. But that would be my message: is let's get back to the fundamentals, and then we'll start seeing the interruption of transmission.
Thank you, Doctor. We have time for a couple more questions off the phone. Please proceed.
Dr. Roussin, what's the community transmission rate for Winnipeg right now?
So in Winnipeg, the 7-day non-epi-linked cases is at 3 right now. But likely it's some of that will be due to a bit of the backlog in entering the contact information into the system. So overall in Manitoba, it's 7 days is at 29.
And the test positivity rate for Winnipeg, please?
4.6%.
Hello?
Sorry, did you 4.6% for the test positivity rate?
Winnipeg.
That's right. 4.2% overall.
Dr. Roussin, Scott Billick from the Sun. Is there an outbreak at St. Mary's Academy?
Not that I'm aware of.
Okay, and I've seen the email now that they are moving to remote learning. Why would a full high school be required to move into that, if not for an outbreak?
Yeah, I'm not aware of any direction that's been given on that, so I can't speak to that. So if we had an outbreak that required many people to self-isolate, then public health may start providing some of that advice. But I'm not aware of public health providing any such advice.
Hey, Dr. Roussin, Sharia here from CTV. Is there a plan to possibly move schools to Code Orange?
Well, we're always looking at the data. Like we said, if we're looking at transmission, schools have been fairly safe. We've seen a lot of cases, but those are acquired from the community. And so once we have cases in school, we haven't seen a lot of transmission, which means that schools have been doing a great job at protecting the students and staff. So, right now we'll continue to look at that. We'll work with our education colleagues, and and there'll be more to come.
Dr. Roussin,
Dr. Roussin, Danielle from Free Press. Dr. Roussin, Danielle here from the Free Press. I was just wondering if you can say for every case that the province identifies as being a COVID-19 patient, how many do you think go undiagnosed in the community?
Yeah, it's a real good question, and there's a lot of variability on this. And so this is one of the goals of a good seroprevalence study. Because we know that there would be, a number of people who don't go get tested for whatever reason. And so it's really, it's hard to know that. We do have some serologic data, but very early, so we can't conclude that, but it's often, you would think that it's, many times more than the cases that we see.
Dr. Roussin, Bartley here again. When will someone from the province attend Parkview Place in person to ensure everything is being done there to control that outbreak?
Yeah, I can't provide details to that. Again, it's not public health that does that, but I'm sure there'll be more to come on that.
Dr. Roussin, Danielle here again from the Free Press on the subject of Parkview Place. We're hearing that the Rivera is asking volunteers to come in and support the folks who are living there. Under this outbreak scenario, is that okay, or should this be completely avoided?
Well, it depends on the situation. The one site rule should be in effect for the most part. So people who are working there or volunteering there should not be in contact with other personal care homes. But it really depends. I'm not aware of the specifics of their plan, so I can't really comment on that.
Dr. Roussin, this is Wency Liang again with the Globe and Mail. You mentioned that nothing specifically has changed with the lab capacity in Manitoba, but you were looking at ways that you could change that. What specifically are you looking into?
Yeah, so there's a number of things along that continuum. So we've, some specifics have happened. So we've looked at, testing site options, right, to get a more streamlined approach to collecting samples. We looked at things just a way that the samples are delivered from various areas to the lab. So we're trying to improve upon that service to get the swabs to the lab quicker, and that involves not only the Winnipeg area but more rural areas there. And then the labs have from the beginning trying to work on innovative ways to try to get things processed on time. We've also streamlined our reporting so that we could report positives online as well, so people will be able to have at least that access. So there's a few specific things, but we're still looking at much more of that review.
Hi, Dr. Roussin. This is Taylor from CHVN. Just a quick question about the new testing clinic. In St. Vital, it's an area of Winnipeg that doesn't have the highest number of cases, but we see starting tomorrow they're going to have 2 testing facilities. Can you explain a little bit more about why?
Well, if you're referring to the clinic there, so we worked with Dr. Manitoba to get a call out on which clinics would be interested and able to get started, and so that's largely where the location came from. We weren't directing where their location was; it was what was brought to us through that consultation process, and so we're looking at expanding upon that model, but that's just how that came about.
Dr. Roussin, Danielle from the Free Press again. Can you give us an update on the outbreak at the Headingley Correctional Facility?
So for Headingley, we have 11 total and 9 inmates.
Dr. Roussin, Barbara Kivas here again. Can you clarify the 5-person rule? Weddings and funerals, are they down to 5 people now too in Winnipeg Metro?
Yes.
Time for 2 more questions.
Sorry, Dr.
Did
Roussin, not here.
Did he answer Bart's?
Yeah, could you please answer my question?
Weddings and funerals, yes. The answer is yes, that the 5 applies to that.
Thank you. As I'm going to go ahead unless someone else wants to jump in. Has anyone entered a COVID alert key in Manitoba yet?
You know what? I'm not aware of that. We can try to find out. I know that because of the confidentiality of that app, I know a lot of it isn't disclosed at the provincial level. So I'll look into that to see if we can, if we do have that information or if we can disclose it.
Thank you, Doctor, and that concludes today's media briefing.